Hi there, Dr. John Quinn here from Quinn Clinics in Bristol. So today I want to briefly talk to you about a treatment called Ultherapy. So this is the Ultherapy device and it's based on a technology called micro-focused ultrasound, sometimes called HIFU, high intensity focused ultrasound. So what this does is it induces collagen production within your skin, and it's used to lift and to tighten. So we use this primarily for the lower face, for the submental area under your chin, and occasionally we'll also use it to lift the brows and to improve the skin quality in the neck. I suppose the reason why I invested in this device as opposed to another device is down to the proof of efficacy. So the company that make Ultherapy, they are the company that have published pretty much all of the articles that show this is a safe treatment and this is an effective treatment. It's the only device that I'm aware of that actually has an ultrasound scanner, so I can visualize specifically the area that I'm treating, and that's really important because every person is different, and therefore it allows me to tailor my treatment to what my patient actually requires. So what we're doing is mapping the face out into zones that we're going to treat with the Ultherapy device. So the cheek in general is mapped into 3 different areas. Just here for me, tilt up for me. So when we're mapping up, we don't treat over the trachea. So just applying some ultrasound gel, and this allows us to visualize what we're doing. And you can see I've mapped the area out into the specific zones that we're going to treat. So this is the Ultherapy transducer. You can see no needles, no sharp objects at all. And what happens is that the energy is delivered between these 2 lines. So it comes out from underneath the bottom here, and that's how the energy is focused to specific depths. The treatment, as I said, is very much bespoke, and the energy can be delivered to different depths within the skin. So the next thing we're going to do is actually use the ultrasound scanner on the machine just to demonstrate why the visualization is so important. All right, can you see? So we can see on this is an ultrasound image of my lovely model's skin, and on the very top you can see the layer of gel and the epidermis of the skin, and beneath that is the dermis and then the subcutaneous zone, and then the target tissue that we're looking to treat. Actually, the bulk of it is above this 4.5mm line, so there is some target tissue at 4.5mm deep, but as we move around, and the context is really important here, in different areas we can see right at 4.5mm, this is the SMAS, this is the superficial musculo-aponeurotic system. So that's a bit of a mouthful, but essentially the SMAS layer, I suppose you can visualize that as being the middle layer of the face. What I'm going to do is just get an image that I can freeze on. So this is a static ultrasound image of the skin and subcutaneous areas in my model's face. So what we can see, I guess, here is the epidermis, the dermis, and then the subcutaneous tissue, and then this is actually our target tissue with the deepest transducer when we're treating with Ultherapy. So if you attend a plastic surgeon for a facelift, the bulk of plastic surgeons will mobilize a thing called the SMAS, the superficial musculo-aponeurotic system, in order to physically lift your face. What Ultherapy does, using micro-focused ultrasound, is actually induce a similar kind of a process at the same depth. And the reason why the visualization is so important is because I've frozen this image now. We can see that actually the SMAS layer in this particular individual and in this part of the face is about 3mm under the skin. So why is this important? It means delivering energy with the 4.5mm transducer in this area will not be beneficial, but actually in theory might be detrimental, because we could actually deliver energy into an area that we do not want to treat. So what this means is that before you have your treatment with Ultherapy, I need to scan your skin to see exactly where the target tissue sits, and then I can be much more precise about what we're doing. Ultherapy is the only device that allows me to do this. So if I couldn't visualize where I was treating, I wouldn't be able to be this precise. And I think that's important from an efficacy point of view, but also from a safety point of view. So what I'm going to do now is turn the mobile scanner back on. If we can go on to the screen again, just so you can see how much that varies. So again, you can see target tissue, and it looks a little bit like a train track. Can you see that? It looks a bit like a train track. So it's above 4.5 millimeters, but it changes as I move. So there is some target tissue in a different part of the cheek area. And now I'm going to move down under the chin area. And you can see how it looks a little bit different. You can see this is either most likely a little vein. There we go, just there. And the target tissue we're looking to treat is here. So this is no longer the SMAS, this is the platysma muscle. So I frequently use this device to treat the skin of the neck as well. And if we look at the image on the ultrasound scanner, we can see that there's definitely some target tissue on the upper neck. But as we move further down, the platysma becomes more superficial. So again, delivering energy at a 4.5 millimeter depth here just won't do what we want it to do. And again, you can see how the target tissue becomes more superficial as we come a little bit further down. And you can see it really well here. So again, this is the platysma muscle, and this is where we want to deliver the bulk of the energy when we're using our Ultherapy device. I just love this treatment. I think it works really, really well. I've been using it for 5 years, but the longer I do it, the more excited I get about, and maybe a little bit nerdy I get